The traditional teaching that the 99.99% of these cases unites without any significant deformity and without any significant functional impairment. But later on, it was found that there are severely displaced fractures, severely comminuted fractures. About 15% of cases require surgical treatment either in the form of tense nailing or the internal open reduction and internal fixation with plating. So let us come to our main topic, that is that tense nailing is unlike conservative management. It provides stable fixation and early mobilization and reduces the risk of non-union and malunion. Tense is less invasive, resulting in a smaller incision, reduced soft tissue damage, and fewer potential complications, making it an attractive option for managing displaced fracture of the clavicle. So we conducted a study between March 2022 to March 2025 on 25 cases of clavicle fracture, mid-third fracture, or were simple displaced fracture according to AO classification 15B1 and 15B2. The age of the patient was 16 to 48 years. No comorbidity was found in our study group. So all patients treated by titanium elastic nailing in my hospital. So the mode of trauma, road traffic accident was the main mode of the trauma, whereas fall from heights and fall on out-stage hand was the other mode of the trauma. So these are the typical mode of injury, the fall on the shoulder to protect the head injury in the road traffic accident. This picture is taken from AI, and this is the typical clinical presentation, a bump at the site of the fracture, and the skin appears as if the fragment will penetrate the skin, and this is the radiological typical presentation, more than 2.5 centimeter displacement, and the Z type of cognition are the radiological indication for the surgical treatment, either in the form of tense or internal fixation with the plate and a screw. So these are the already explained. The simple fracture we are taking into consideration. Displaced simple fractures, either spiral or oblique or transverse or short oblique, 15B1 and B2. The patient lies supine with the affected limb elevated and the arm are hanging outside the table, so that we can facilitate the abduction and external rotation at the shoulder to facilitate the reduction of the fracture by closed midge. The incision, a small incision, either transverse or longitudinal incision, about 1 to 1.5 centimeter, just lateral to the sternoclavicular joint is given. Adductor making an incision, we make a hole with the help of drill bit, and then we make this hole continuous with the intramedullary canal of the clavicle. But this is very, very crucial step. One should take his own time and use tips and tricks to do this step, because the heart and lung, like vital structures, are waiting for your instrument to escape. So after making the hole, we did tense nailing after close reduction or mini incision reduction. So the immediate post-op pain management and immobilization, at the 2 weeks we did suture removal, at 6 weeks radiographic assessment of the fracture area, and 12 weeks the functional assessment, and if required the implant removal was done. And the operative time was 30 to 60 minutes, whereas fluoroscopic time was 10 to 30 seconds, and the blood loss was 20 to 50 ml in all our cases. So the excellent result in 76% of cases, whereas 16% cases were good results, and fair and poor results were 4% each in our study group. The complications are nail bite-out, superficial infection, and the malunion, each were 4%, whereas hardware irritation was 8% in our study group. And these are the few cases. You can see that 15B1 fracture treated by titanium elastic nailing, beautiful surgery without use of any instrument. The reduction has been done only by shoulder movement, external rotation and abduction, and with the help of the thumb and index finger. The beautiful surgery. And this is another case, yet another case of the 15B1 fracture treated by titanium elastic nailing, yet another case of 15B1 fracture treated by titanium elastic nailing. These are the 15B2 fracture. This is 15B3 fracture treated by titanium elastic nailing. Ideally, it should be treated by open reduction and internal fixation, but we did tense nailing and can see the 6-month follow-up, the beautiful radiological union is present. And this is the functional result. You can see so time is less. So the limitation of this surgery is a small number of cases included in this case, in this study. So the short follow-up period and retrospective design. So a study with large number of population and long duration of follow-up and prospective study is required to establish this modality of treatment as a attractive option for the treatment of displaced fracture of the take-home message is TENS nailing is effective for the clinical fracture with good to excellent outcomes, minimum complication if the patient are selected properly and the technique is performed properly. The further study are needed to confirm the long-term efficacy of this. This work published in International Journal of Orthopedic Science